Hello everyone, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Congratulations, you did it. You had your facelifting procedure and now what do you do? This is what I tell my patients, and it is good for preparation if you're thinking about it or for reinforcement if you've just had your facelift. If you are making any medical decisions, please do so with your doctor so they can take your health history and your goals into consideration and make the best decisions with you. Now, immediately after a facelift, you will likely be groggy from your relaxing medicine. That is why this is a good video to review. Maybe once or maybe more than once, or watch this with whomever you're with so they can see it too. Let's start with your caretaker or companion. If you don't have one, call someone who can check in on you. You may need something from the pharmacy, or it's good to just have someone nearby just in case. To keep this simple, we agree with the RICE principles for your recovery. Rest, ice, compression, and elevation, and I will also add my 4 F's of recovery. Don't worry, you won't fail, but the 4 F's will make you feel good in your recovery. Rest is important in the RICE formula, R for rest, RICE. This is important. I do have some of my high-achieving patients, and they may find it hard to stay still and rest and relax. Don't overdo it. Now is your time to practice being an overachiever in meditating and relaxing, and find a meditation video on YouTube if you have to. And if you got to be an overachiever, just be an overachiever in doing nothing. In the RICE formula, the I stands for ice, and ice is helpful. Just remember that the compression wrap actually does a better job than the ice, but you can use the ice with the wrap in front or behind, but you may not be able to feel the ice because your skin is numb after the facelift. Some patients love the wrap and some want to be done with it as soon as possible. So C stands for compression, the compression wrap, and we like to wear the wrap for 4 days around the clock and 1 week at night. The goal of the wrap is to reduce swelling and reduce the risk for fluid collection. If the wrap irritates or chafes your skin, 2 to 3 days after the lift, you can remove it. So don't keep it on if it's irritating your skin, but it is important to wear it for that first 24 to 48 hours continuously for your best results. And the last letter, so we've got rest, ice, C for compression, E is elevation. Keep your head elevated. You don't have to sit completely straight up, but sit as elevated as possible so that you're able to rest. If you lay flat, you're going to swell more. So these are the recovery basics, the fundamentals, and in our next video, we discuss our 4 F's of a smooth recovery. And you will be so happy that you're prepared for the 4 F's, where we will see you in the next video.